27 Lyon. I'm a volunteer physician with a group called Partners in Health. We're a nonprofit organization based in Boston and currently working in a few countries. I work almost exclusively in Haiti, where I spend about 6 months of the year. Our group is also active in Peru, Rwanda, former Soviet Union, and in Chiapas, in each of the places doing community-based health care. In Haiti, we have our largest project with 7 separate hospitals and a community-based organization of 2,500 employees and many, many more volunteers. I've come to the World Social Forum to represent the work that we're doing in Haiti and to represent the colleagues of mine from there that can't be here. The thing that's most relevant to me and to us about this World Social Forum is that we feel we're doing work that's very similar in a few ways. First of all, Venezuela is part of the Caribbean, and Haiti, while it's often forgotten or often left out of the news, is very central to Caribbean history and to Caribbean present. So I hope to meet up with others who are doing organizing work, health work, and work toward progressive political change. As watchers may know, Haiti's in the midst of an occupation started by a U.S.-sponsored coup in February 2004, followed by UN occupation, and now a brutal interim government that's completely destroyed the popular movement and pushed Haiti back at least 50 years politically, and so I feel a conference like this will at least be a chance to see some light at the end of the tunnel. The work I do with Partners in Health is focused primarily on HIV and TB work. Haiti is the most HIV affected country in this hemisphere. Haiti, despite having 25% of the population of the Caribbean, has 60% of the HIV. So our project has been organized around provision of HIV care. We're currently taking care of about 3,000 patients on standard first world therapy in the community, supported by community health workers and health promoters. In that context, we also take care of a lot of tuberculosis. All that said, and those are my interests, the main problems in Haiti are still based completely in poverty. We deal with a lot of malnutrition, diarrheal disease, respiratory infections, complications of pregnancy and childbirth. All of this in the context of community-based care. Our organization, Partners in Health, was founded by a physician anthropologist named Paul Farmer, who's made a name for himself and for us as an advocate, as a writer, and as a doctor. I've worked with him now for the last 8 years in Haiti. People may also know his name and the name of Partners in Health through a book called Mountains Beyond Mountains. It was written by a writer named Tracy Kidder, who followed Dr. Farmer around for several years, working on this book and trying to document the work we're doing mostly in Haiti and in Peru. The work in Peru was focused in a different way on a single disease, where the work we do in Haiti is focused on community-based care, prevention, water projects, education, illiteracy work, and community organized structure in general. Another reason I've personally come to Venezuela is to take a look at a revolution that seems to be happening. In Haiti, we're moving backwards. As many viewers might know, Haiti suffered a coup in February 2004, organized and sponsored by the United States, that removed a popularly elected and fairly effective leader, Jean-Bertrand Aristide, to exile now in South Africa. Since that time, there's been an interim government, a completely illegitimate government that's been brutally suppressing and taking apart the popular movement. There's not much left of that popular movement. The popular movement's chosen candidate, Father Gerard Jean-Just, a Catholic priest and a peace activist for many years, is currently in jail. He's also currently suffering from a treatable cancer, but has not been allowed out of jail, despite the fact that the Haitian courts, which are a mess themselves, dropped one of the most significant trumped-up charges against him. Another story that's largely been untold in Haiti, there's been an illegitimate caretaker government since February 2004 that's used its police force with almost full impunity to take apart the popular movement that's left over from Aristide's Lavalas party. Another story that's still really not known to much of the world is that the UN, at the advice of the United States, has sided with the Haitian police in these repressions. So while the UN has a long history of sins of omission, places where they've gone and not stopped bad things from happening, in Bosnia, in Kosovo, in Rwanda, in Haiti, the UN has been actively involved in killing of poor people, suppression of the popular movement, and including the jailing of Father Jean-Just, the priest I was speaking of before. The UN pulled him from a funeral where a riot broke out and took him to jail. Another recent development in this story is that the business class, the elite that's ruled Haiti for much of the last 100 years, asked the UN in a very bold fashion, asked the UN to further repress the popular movement because they're afraid that the elections, which are now delayed over 5 months, postponed 4 times, only half the population is registered to vote. There are 10 times fewer polling places than are actually needed for this election to go off in a representative way. The business class is still worried that they're not able to control this election, and so they asked the UN to further suppress the poor neighborhoods inside of Port-au-Prince that are still holding some support for the popular movement. In that context, the Brazilian leader of the UN shot and killed himself, or was killed by someone, and was replaced by a graduate of the School of Americas, someone trained as a repressor in the United States, a general who worked under Pinochet during his dictatorship. He's now, for the last 2 weeks, in charge of the UN, quote, peacekeeping movement, end quote, in Haiti. There's a lot that will still come out, and I think it's a situation that deserves careful attention. Another reason to tie into this conference is the ongoing peaceful revolution in Venezuela. We know that there's a lot of connection to Cuba and to the Castro government. In Haiti, the next island over from Cuba, just separated by just 60 miles, currently there are about 400 doctors working in Cuba. 30 or so work in our system as specialists, doctors and nurses that we don't have in Haiti, surgeons, obstetricians, anesthesiologists, community health nurses. All those doctors in Haiti are supplied by the Cuban government, they're paid by the Cuban government, and they work in free collaboration with anyone in Haiti willing to have them. Haiti graduates a decent number of doctors every year, about 300 every year now from 2 medical schools, but a full 80% of those doctors leave within 5 years. The brain drain from a small country like Haiti, close to the United States, tied into the American economy, the European economy, into Canada, loses most of its professionals. And if Cuba was not there, we're not sure that we would have enough. If Cuba was not there, we would have many fewer doctors than we have now. So I'm hoping to meet more people from Cuba and others from the medical community here in Venezuela who I know are thinking in a regional and pan-South American way.